this video, we're going to talk through how to properly engage your transversus abdominis muscle, which is the muscle that is responsible for stabilizing your spine and your pelvis, and is very important for retraining your core muscles for stabilization. So we want to first be able to visualize where that muscle is. It wraps around from your belly button in midline here, all the way through to your lower back. It attaches to your ribs, all the way down to your pubic bone. And so these lower fibers come up like this, middle fibers go straight across, upper fibers come down slightly. You can just envision that being like a corset wrapping around from front to back. So if we want to engage this muscle, we want to be not only just feeling it in our body, but we want to check it with our fingertips, especially these lower abdominal muscles. So find the bony part of your pelvis, the very tip of your pelvic bone that creates a little point. Bring your fingertips and wrap them in slightly so you're on kind of this squishy area of your core. Now, when you breathe in, you want to feel everything relax and soften. So your belly's going to expand, pelvic floor is going to expand down. And then as you exhale, this is where we're going to contract that muscle. And you're going to exhale and draw your belly button gently in towards the spine, just ever so slightly. And thinking about using an exhale through pursed lips to really engage the core more strongly. So deep breath in, everything relaxes. Breath out. Engaging the core. What we should see if you're looking at the stomach is that everything flattens and looks like one sheet from your rib cage down to your pubic bone. So as you exhale and engage your core, your ribs should drop down and in as those muscles are contracting to pull them tight. You should also be feeling firmness underneath your fingertips. So it just feels like somebody's pulling a tight sheet between these 2 points, but not so much that your fingers are getting pushed out. That's called bulging or bearing down, which are not what we want to see. So if you ever see your lower abdomen come up towards the ceiling or push your fingertips out of the way, we're not using the correct muscle and you want to reassess and try again. So you should feel firmness here. You should physically see your ribs come down and see tension and tightness come through here. What you also may feel is that as you're engaging this transversus muscle, your pelvic floor engages, and that is normal and should be happening automatically. But if you need to, you can also think about slightly engaging the Kegel before you engage the abdominal muscles, and sometimes that can be helpful to get more contraction through your transversus muscle. So again, deep breath in, everything relaxes, and out. Contracting, pulling the ribs down, pelvic floor lifts, and everything flattens through here.